The psoas plays a huge part in helping us to have efficient alignment and postural integrity. And a super tight psoas is going to really interfere with the ability for your rib cage and pelvis to be super harmonious. That tension is going to create shifts both in the position of the hip and in the position of the spine. So I'm going to show you a couple of simple things you can do both to roll out and a really simple movement exercise that can help really release your psoas so that you can find a little bit more of a neutral posture. And then obviously you want to train yourself once you find neutral to maintain your psoas in the most ideal scenario. So just a quick review, the psoas starts at the 5th lumbar vertebra. It's on the anterior surfaces, the anterior lateral surfaces of the lumbar spine, and it inserts onto the inner thigh. And then next to it, and equally important, is your iliacus, which fills into the front of the pelvis here, also inserting into the lesser trochanter. So come on down to the ground and find yourself with a Coregeous ball by your side and hopefully an alpha, because you're going to need those for the rollout. Lay on your back for a full corpse pose check-in. Now, corpse pose is a great tell in terms of the rib cage to pelvic alignment, because what it's going to tell you about is the amount of tension that's on your lumbar spine from the psoas. Because right now you're in full-on hip extension, and so if you have a really tight psoas, what happens is it'll pull your lumbar quite far off the floor. So a good way to check in is to take your hand and bring it underneath your lumbar without, don't lift your lumbar to get your hand there, but just check in and feel how much space you have between your lower back and the ground, or more even specifically, if you can try to feel where the bones are. Yeah, you can check it out on both sides, because often we have a difference on one side than the other. I certainly do. You can feel which one is more spacious. And then find your Coregeous ball and then take it. We're going to go right into a mix of psoas and iliacus on both sides of the abdomen. So to find your psoas, which you're not going to find because it's so deep, but we're going to angle our way there, is bring your Coregeous ball to the side of the abdomen, the side front of the abdomen, and just lay down upon it. I've got my other knee out to the side here. Take a breath into the Coregeous ball. Hold your breath and then contract your core and then push your thigh into the ground. So I'm activating the hip flexors, the iliacus and the psoas. And then exhale and let go. And do that again. Breath in, hold, contract, and then thigh into the ground. And then exhale and let go. Then in slow motion, draw the pathway from iliacus up towards and along the psoas towards the ribs. So I'm just biasing this sort of sideways vector and rolling and smushing and mushing my way in terms of a vector of pressure there. Just trying to see if I can have some tender touch to tell the psoas it's okay to lengthen. It's okay to lengthen now. And then go ahead and switch sides, and we'll do the same thing on the other side. And you're more than welcome to stay there and linger longer. I'm mostly doing a demo here, but if I were you, I would give each side a good 4 to 6 minutes. Breath in, hold, contract, and exhale, let go. Breath in again, hold, contract, activate the thigh, pushing it into the ground. And exhale, let go. And do that one more time, because you might have noticed I forgot to do it the first time. Breath in, hold, find your core, press the thigh into the ground, activating psoas and iliacus, and exhale, let go. And then drive your way north-south through the abdomen, but really thinking through the anatomy of the psoas and thinking about lengthening your way up and down. Now linger longer if you have a little bit more time. I'd highly recommend it. And then next, going to grab a hold of your alpha ball, and we're going to work on the quadratus lumborum. So the quadratus lumborum also is a guy wire for rib cage to pelvis alignment, and that muscle, you can see, covers a good portion of the upper pelvis and hooks into the lower rib. So excess tension in the quadratus lumborum also is going to sort of disassemble a ideal, optimal, efficient torso. So to find your quadratus lumborum, you'll sandwich the alpha ball, not in the side of your waist, but in the back side of your waist, and then just rock over and let the ball dent into the back of your waist, and it will rest and hook right onto the quadratus lumborum. And all I'm going to do here is create a really gentle side-to-side rocking action so that there's a little thrunk into the side of the QL again and again. Deep breathing, inviting that therapy ball into this really deep postural muscle. There's other muscles in the way there also. Go ahead and go to the other side. Definitely linger longer if you have more time. And coming to the other side, same thing. So you may notice right away that there's a difference in texture from one side to the other. One side might have more resistance, one side might have less resistance. So I'm simply rocking from side to side, and then I'm going to give you one more bonus move on this side, which is a little tuck, untuck of the pelvis. Little tuck, untuck. And what that will do is create a little bit of shear at the soft tissues covering the QL as well. Then pull the ball away from the lower back and reset your Savasana position, and just take an immediate impression of how your low back feels, and if there is a shift in the height in your the distance between your low back and the ground. So you can take a really quick blitz of your hands there. And then we'll do one final mobility exercise here. It's a passive mobility exercise. It's called the Axial Rocks. You'll anteriorly tip your pelvis forward. So you'll deliberately arc your back, and that will thread a big back bend through your whole spine. Your head will nod forward. And then you'll move in the opposite direction, posteriorly tilting your pelvis. Your spine will dump into the floor, and then your head will go to the top of the nod. So you'll inhale, anteriorly tilt the pelvis, and exhale, posteriorly tilting the pelvis. Moving in super slow motion, as if you're creating a lullaby to rock the psoas to sleep. So sometimes the gentle movements of rocking can just reflexively relax any muscles that are held in unconscious tension, and that of course includes this major muscle of the psoas. So you can spend 3 to 5 minutes doing those axial rocks, and then of course rechecking, coming back into your full Savasana position, feeling what your back body is feeling, and then once again sneaking your hands underneath and noticing if there has been a shift. And so if your psoas has been on high tension and it's yielded to the practice you just did, then what you'll notice is that your lower back is slightly lower to the ground. If what you just did made your psoas kind of angry and pesky, you'll find your back even further away from the ground. But hopefully you have that first result, that there's just more softness and placidity there, and that your psoas, your psoai, have released. Now it's always important that after you release a muscle that you want to strengthen it in its ideal alignment. So now take your body, if you're not going to sleep right now, get out there and do some exercise that optimizes your new alignment.